Hello, my name's Jim Gardner. I'm the Medical Director at Blackpool Teaching Hospitals NHS Foundation Trust. This is my COVID update on Wednesday, the 28th of April 2021. And the COVID numbers story is that today we've got just 2 patients who are within 14 days of their first positive test. I think that was the same number as I gave you last week. We've had no further COVID associated deaths in the last week, so that's deaths within 28 days of a first positive diagnosis. And we've also got another 6 patients who are in hospital because of COVID, but they're more than 14 days from their first positive swab. So there are 3 on the Blackpool site, 3 on the Clifton site, and I'm delighted to say none in our critical care units. So that's another significant move in the right direction. And that matches the numbers across the community, where we're seeing the figure for Blackpool as 11 positives per 100,000, Fylde at 6 per 100,000 and Wyre at 9 per 100,000. We were in double digits last week, so we're still seeing this really positive reduction, and well done to everybody for contributing to that matter. What it does mean though is if anybody feels that they're symptomatic, if you've got any symptoms, if you like flu-like symptoms, you'll remember the original list of symptoms, but it's essentially flu-like symptoms, then please remember to go and get a test. There is loads of testing capability available, and the easiest way to access it is by ringing 119 or by going on the NHS UK website. Vaccinations, of course, are going ahead all across the sites. We're into second dose vaccinations for many, and of course we've opened up now to the over 45 age group, and that's moving very quickly down into the lower 40s. So if you're in that age group and you wish to get a vaccine, then again please dial 119 or go on the NHS UK website and you'll be able to book an appointment. On site for us, still very busy, of course. I've talked about us restoring all manner of activity, and our emergency department's been extremely busy still, and I think that's played out across the whole of the Fylde coast. So it's just a reminder to say that if you're poorly and you are thinking about how to approach the system, of course if it's a life-threatening condition, then please dial 999 and the emergency services will deal with you appropriately. But if it's urgent and not an emergency, I'd urge you to just think about the possibilities of self-care, about contacting your local pharmacy for advice, using the NHS 111 number, or indeed getting in touch with your GP practice. It helps to make sure that people get the right care in the right place, and that we don't put particular burden on particular parts of the system, where we're still trying to make sure, of course, that we can keep safe distancing, and so on. Visiting has reopened at the hospital, and that's different for different departments. I think that's the important point. So if you've got a loved one in the hospital and you wish to come and visit, please have a look at our website, because it will give you the specific details of the visiting arrangements. And if you do come on site, we will ask you to put on a surgical mask and abide by our own infection prevention and control procedures. One really interesting development in the COVID story, and the UK I think has been great at this, is another research study. So think back to the introduction of AstraZeneca jabs and the Pfizer jab and the Moderna and so on. There's a new vaccine study going on called the Valneva vaccine trial, and this is being run partly through Blackpool Hospital, and we're actively recruiting to new patients, essentially in the, I suppose, under 40 age group, although if you're over 40 and you haven't had a vaccine, you would be eligible. And the recruitment is being done through the hospital, and there is a web link which would allow you to get access to the information, but also to book to come on the trial if you're interested. I'll just read out the website, if I may. It's www.ukcovid19study.com, and that will be linked to the video as we release it. But it's another piece of the story of the science developing and the ability for us to grow this this wider repertoire of vaccines that are available to people, which could prove to be quite an important part of the armamentarium as we go forward through the year and so on. So in summary, still a very positive picture. People are clearly doing the right thing, being careful as we open up society. We've another step coming in a couple of weeks, and we seem to be on target for that. So thank you very much for all of your efforts, and please look after yourself and each other. Thank you.